Hi everybody, and welcome. I've decided that over the next probably from now on, I'm going to be doing these kind of regular kind of podcasts, talking to people. We've just had a former director of the Bill and Melinda Gates Foundation speaking to me essentially about what Bill Gates is up to. And Bill Gates has recently said to world leaders, so this comes no surprise to Boris Johnson, Matt Hancock, or any of the other world leaders involved in what's going on, is what he said is this: I'm doing today what J.D. Rockefeller did for medicine. By 2025, doctors will be no more important in societies than car mechanics. That's a quote from Bill Gates. So we've been looking around, and I've been pointed in the direction of various policy papers and plans that the NHS has. This is new information, I believe. I don't think this has been out anywhere else, and it kind of makes sense of health passports or vaccine passports, whatever you want to call them. This is all makes sense. So back in 2011, I found evidence of the health passport system. And it had been renamed from the digital ID, if you remember, under Tony Blair, and they're now calling it the health passport system. So we discovered that, and then when this began back in 2020, early 2020, I came out with the video about health passport systems, and we found companies that had already developed the software to go on your phones and all this kind of stuff. And we laid it out, and everyone laughed, and everyone said, "This is impossible. This is just not going to happen." Well, it happened, didn't it? So I'm not a "I told you so" sort of person, but this is all about taking things a bit more seriously than perhaps we did before, and examining things and looking at things. So I wanted to do that in depth, and I have a massive of information here. This is all new. So we're going to go through it, and we're going to go through it bit by bit, and hopefully by the end of it we'll build up a picture. So my whole issue with health passports was this: I knew that it was the cherry on top of a surveillance sort of pyramid that includes everything, from your phones to your computers, where you go, what you buy. We know all of that now, right? That's obvious. But I didn't know what the end game was, what it was for. Just to say that it's a surveillance society, well, maybe it was good enough back in 2020 when all this sort of kicked off, but it's not good enough now. So with what Bill Gates has said, and the information I've been given by a former director of the Bill and Melinda Gates Foundation, who is also part of the World Economic Forum, by the way, and regularly attends Davos meetings, etc., has pointed us in the right direction, because everyone is concerned about this. Look, there's lots of people that I think are involved in these organisations that are essentially picking sides now. They're in there, they're getting information, and they're putting it out where they can. I've always been someone who's been very open. As an investigative journalist, people came to me to tell me stories. I did my own stories, and we do things that way. So when people want to come and say things, I listen. There was some information that a Google employee sent me right back at the beginning. That was all about what Google were up to and all that kind of stuff, and I didn't run with it. Because I wasn't sure. I wasn't sure who the person was. I wasn't sure how accurate the data was. As it turned out, it then appeared some months later in the Daily Mail. Other people ran with it. Other researchers has found it, and it turned out to be genuine. So I miss things all the time, and I'm happy to. I don't have to run with things. So when I do, I feel that it's important. I feel that we've done the research for it, and here it all is. So the NHS. So the health passport is the marker, had to be brought in for this to happen, for the lockdowns to happen, for everything to happen, and the track and trace to happen, all that kind of stuff had to happen, in order to get the last little bit of data that Bill Gates, Matt Hancock, the government needed to destroy the NHS and create a new NHS. The new NHS, which is no surprise to people, is called NHSX. It's got an X on it. So that means that they can get rid of the old NHS and they can bring in this new NHS, which was brought in, by the way, in 2019 and has been lying very, very low. I'm not sure who they were looking for a chief executive not so long ago for the NHSX. And so NHSX is the digital version of the NHS. So the NHS is gone. It's gone. It is now a digital NHS. And so you're going to be introduced to a new chief executive, into a new way of thinking. And this is what the Build Back Better thing is all about. This is what the Great Reset's all about. In part, amongst other things, but we're just concentrating today on the NHS. So it's called the New Joint Organisation for Digital Data and Technology. It's called the new NHS. You're not going to have doctors and nurses. They're going to be few and far between. What you will have now is the use of AI, which is what they've done. So the lockdowns were to bring in this whole idea, because what has actually happened, this is what we have to think about. What happened with the lockdowns is that you weren't allowed to go to your doctors, you weren't allowed to go to hospitals, so you had to stay at home, and if you were poorly or you had an accident, you would call this NHS number, right? And they would take you through a series of questions, right? Do you have this? Do you have that? It's an AI. Yeah, all it is collecting data. It's a basic program essentially. If that then was deemed you worthy, you would then get put through to somebody who may be some sort of nurse practitioner, and then maybe a doctor. And some people during this time, when they were having to see people online, because that's what this is all about, is moving you. NHSX is a digital online NHS. They are not going to have hospitals anymore. They're going. Yeah, as you know it today. They're not going to have GP surgeries. You won't have a GP anymore. GPs are gone. That's why, Bill Gates has basically said that, look, you got to get rid of the GP surgeries, because that's where people get sick. GP surgeries and healthcare centres in other parts of the world, where you walk in with one thing and you come out with another, and actually, to be fair, we have all experienced that. I know I have. That's where they have all the magazines down, so that you thumb through it so you get sick. It's one of those kind of keep you ill kind of cycles, so you give more money to the pharmaceutical companies. So this is kind of making sense now. So the health passport was there to collect data. We know that. But what for? So it's for NHSX. And NHSX needed a little bit more data. So what they had to do is they had to lock down the country. And this is why it was very convenient for COVID. They were waiting for this pandemic. They were waiting for the excuse to lock the country down. Why? Because they needed to. And for the last little bits of data. And if I go through to here, we've got there's loads of information here. Where is it? They needed, they now know that 500 million people contacted the NHS during the lockdown. And so here we go. This is it. So I've got all this data here. So this is the digital services that they already provide, and what they needed to know was how many people would contact the NHS. So what they did was they locked down the country, and they got that piece of data, and they received 500 million visits to the NHS website, and via the NHS apps they collected more data, and so they could see how many people they needed to manage. And what they did was that they ended up effectively managing people over an app, over the NHS website and over a telephone and being online. And that's what they wanted to know. So 500 million people they were missing, they now have that data. All this is going to be run through the Amazon and Microsoft servers. They've already admitted this. This is called the public cloud, and this is for resilience, backups, and cyberware. This is all going through Amazon and Microsoft. And Amazon, you'll see later, is actually working to tell people what to do, clinicians telling them what to do in care homes and stuff. So we'll get to that in a little bit. It's also to develop the skills and culture. What do they mean by that? So develop the right skills and capabilities so staff are supported and leaders are able to drive the best outcomes. The right skills are not only digital skills, but the leadership and change management skills needed to improve the service. And so essentially what's going to happen and what is happening is nurses and doctors are being got rid of. They reckon that they can run the entire health service on about a quarter of what they presently have. So that's doctors and nurses, basically, isn't it? And surgeons and what have you. People who administration stuff, they're going to get rid of everybody, 3/4 of it, to have a quarter left. And this is where the vaccine comes in. And this is where, NHS staff are refusing to have the vaccine. And they're saying, well, you'll lose your jobs. Of course, they want them to go. If they say, yeah, we can sack you on the basis of you not being, having a vaccine, that's great because they get rid of a whole bunch of people straight away. And that's what they wanted. So now what they're going to have to do is they will be doing a little U-turn because they're not quite ready yet for this system. I think they've got another year or so to go, or it's at the back end of this year, maybe next year, this is going to roll out. This is going to be by 2025, basically. By the 2025, all of this will be in permanently, yeah. And it gets weirder as well especially when they're telling you what you can eat and what you must buy, and this is all going to be run through your NHS app. So this is the way it's going. So by 2025, all this is in. The standards of what they're doing and how they're doing it, there's some really good ideas here, I'm sure, absolutely certain of it. But the way they've brought it in and what they're doing is appalling. COVID-19 is the excuse they're using to change the health system, and this is it. Citizens who wish to personalise their use of health and care services will be able to access their records. This is all of their records. It will be on your phone. Essentially, that's why Apple's all about privacy, right? And yet you're going to have all your health records on your Apple phone and other, your Google phones and all the other Android phones as well. Have your health records on. Look, the reason that we go to a hospital, we go to a GP surgery, is we want privacy. We don't want to be getting our private parts out in front of our video camera and then having that data being then stored in the Microsoft or Amazon cloud for anybody, by the way, to view. And that's important. If you're involved in NHSX and the new NHS, you'll have access to this, and also perfect strangers will have access to this as well, to your health records and your data, and we'll get to that in a little bit when we sort of start talking about who has access and why. So this is all about getting you a better experience, obviously, and so you'll have access to all of your health records and all your health data, but along with everybody else as well. If I just come down to this is the open standards idea that they have. So essentially, open standards means that if you're a researcher or if you're a company that you want to create an app for the NHS, this is all about apps for the NHS essentially, then you will have access to the data of the public health records. Basically, you'll have my data, you'll have everybody's data in the country in order for you to develop your app or to develop your device or whatever it is. Yeah, the idea of the MHRA has disappeared. That has gone now. We know that. June Rain, who is the CEO, was one of Bill Gates's favoured people for lunches in Switzerland, and she was flown all over the world and this and the other. And that's a matter of public record. We've got the receipts for her hotel stays all paid for by the Bill and Melinda Gates Foundation to have meetings with Bill Gates in order to bring all this in. See, so this is kind of sort of starting to make sense now, and so for far too long, this is quoting now from this document, which is the future of healthcare and a vision for digital data and technology in healthcare. And you can find this off the government website, which is where I was directed to find it. A lot of these things, when you're dealing with people who are basically giving you information at a high level, they will pinpoint. They'll say, "Go, it's on the website. Just go and have a look." But because we don't know where to look, and often these things are buried in mountains and mountains, you have to put the right keywords in to get it. Well, we've got it now. So it's there for everyone to see the open standards and principles. So everybody has access to all of this. You won't have. So for far too long, we've done things nationally that get in the way of local health and care organisations. And now using technologies to serve their populations, we have missed the opportunity to set the rules. And so this is about setting kind of minimum standards about how you're going to be dealt with, and it's all going to be online. You won't need to go to a hospital, you won't need to go to a GP surgeries, GPs are no longer needed. And this is, I think, all part and parcel of the idea of now we've got to educate, sort of getting this information out to doctors and nurses. They want you to go. They're looking for a quarter of the current workforce to handle all of this. If you're going to be a GP, you're going to be an online GP, or you'll be a nurse practitioner who then gets your prescription signed by a doctor who you will never see, who you'll never talk to. But they'll have access to your records, and if something stands out, they'll look through it. They might see some of the pictures that you've downloaded and stuff and say, "Oh, okay, yeah, the nurse practitioner's right, here's the thing." I've had that a couple of times. I've called up the nurse, see my doctor at my surgery, and I've been told, "Well, you can't have an appointment with the doctor, but you can see the nurse practitioner." And it usually is a quicker appointment, so of course you take it, the nurse practitioner sees you, makes a diagnosis, gets it checked by a doctor who I've never seen, and she comes back with a signed prescription. But this is how they're going to do it. So instead of you doing it at GP surgery, you'll be doing it over the phone, you'll be doing it from your computer, you'll be doing it from home. So one of the really kind of out there things was people who had cancers and people who were undergoing chemotherapy treatment. And one of the things, what they did was they stopped all that. And so in the future, you will, and the future is now, by the way, this is coming in now. This is kind of one of the biggest political changes this country has ever seen, and people don't know about it. And I think it's disgraceful, it's disgusting. And people can't get treatments for cancers. You'll all get that at home now. And in some ways, that might be better, mightn't it? You'll be more comfortable, you'll get it at home. I don't know what happens when something goes wrong. You'll call for an ambulance, and teams of people now come with ambulances, if you've noticed. It isn't just like two guys, a driver and a paramedic, and they interchange. You often get doctors that now come with the paramedic teams of 4 or 5. I've noticed that are turning up with ambulances and stuff. So that might be the norm. You'll call for an ambulance if they get there in time, or you'll be advised over the phone what to do. Like there was a guy having a heart attack who called up the NHS number, and they basically told him to sit up straight and have a glass of water. That's the kind of advice that you're going to get more and more. Of course, with the vaccines, they have created customers now, and they know exactly all the effects of those of the gene therapies. So they know exactly what people are going to be presenting with and stuff like that. So all those people, they don't want them in hospitals. They want them to stay at home because they know exactly how to treat them. It's prescriptions, it's this drug, it's that drug, blah, 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 depending on how it affects you. So you're going to have here local system leaders, because this is a digital system. You don't need administrators anymore. This is local system leaders. And they will ensure that the technology is available to staff and meets their basic needs, that the internal processes aren't preventing staff from making the best use of technology in their jobs. Use of IT systems should not be an additional burden. They need to be extensively trained for. We need to build technical skills in the whole health and care system to help professionals and leaders to manage their technology, articulate their user needs better, and buy the best tech. So you're going to have a system leader. So all those kind of managers that you've had to be dealing with are gone. They don't need them anymore, which is why they're trying to get rid of them as well, and all this kind of stuff. And they're making life absolutely miserable for everybody within the NHS. I mean, this is out of order, of course. And what they want to do is create an ecosystem, as they call it, for the just as we have created a world-class ecosystem to make the world leader in fintech. There is no reason we can't do the same in health tech. And so the NHS has teamed up with the Bill and Melinda Gates Foundation to move this thing forward. Bill Gates has basically said, and again I'm going to repeat this, and I'm going to keep on repeating it, by 2025 doctors will be no more important in society than car mechanics. If that, as a doctor, does not concern you, then you are in serious trouble and you need to start asking questions. And actually it is for the doctors now and the nurses to go to the government and say, no, we're not going to put up with this. You know, you're going to be told that you're old-fashioned, that things need to change, and things do need to change, but they don't need to change like this, and they need to change with public consultation and debate. We live in a democracy, apparently. So they're building an open culture, which means everybody from researchers to developers will have access to your records. Your NHS number will be used for everything now. So that 10-digit NHS number is your number that basically you're getting tattooed on your arm. You're not literally getting it tattooed on your arm. You know, it's the Nazi version, isn't it? The tattoos on the arm. This is the NHS number that you'll have to carry with you. And this is for all services. So, and everything that's going through health now, right? Everything's going through health. So your NHS number is going to be linked to your bank account. They will know who you are because your NHS number is accurate because they link to your health records. And so your NHS number is going to be the link to everything, which I think is scary, which isn't right. We're getting rid of doctors, nurses and all those people favoured for clinicians and social care workers. You're going to be called a clinician or a social care worker. That's all they need in the NHS, in the new NHS. They don't need doctors, nurses, or anything like that. Few and far between. It's clinicians and social care workers. And here it says, we will know we have I should say, actually, at the top of this page is COVID-19 has enabled us to to put our tools in modern browsers. Make the internet first, public clouds, to build the public cloud, to build a data layer with registers and APIs. So this is all that COVID-19 has enabled them to do. Adopt the best cyber security standards, separate the layers of our patient record stack, hosting and digital services. So what they're doing is they're not going to hold your records all in one place. Your records are going to be wherever you are. So wherever your whatever your area is, wherever you live, they're going to have little servers everywhere. So your health records will be held on a server nearby to you, a bit like a phone exchange, kind of thing. And so then you go to a dentist to have dental treatment, a bit more health records will be there, but it's all on the same system. Yeah. So they're not going to have one big server with all your data in it, because obviously, if the system gets hacked, it all gets stolen. That's all of your data gone. But they're going to have lots of little things. So that's what this is. COVID-19 has enabled them to separate the layers of our patient record stack, hosting, data, and digital services. It has enabled them to build the infrastructure, to basically build a culture and put in place the right infrastructure, buy the best technology. COVID-19 has enabled you to buy the best technology. Great, thank you. Ensure the digital services meet people's needs, enable health tech and innovation, develop the right skills and capabilities, build an open culture. We will know we have achieved our goals when a healthy person can stay healthy and active using our wearables and our diet tracking apps. So they will be able to tell you what you can eat. So, you will have a diet tracking app that tells you what you can buy and what you can eat. This isn't made up, this is in this document. So you'll have wearables. So this is a watch, this is this is not a phone, this is something that is going to be on you. And it's going to be saying, okay, so this is your diet. It's going to be prescribed to you by your clinician. And it says, this is going to be your diet. This is what you need to eat. So that's what you can buy. That's what the health passport was for. Because if you remember with the health passport, it had the idea that the medical professional could turn on and turn off various things. So if you smoke, they'll turn it off. You can't buy cigarettes because you have to buy it over the digital currency, which is what they've done as also. So this makes sense of that as well. So they're getting rid of cash, and you can it's only pay by card. It's digital, so they will tell you what you can eat, and what you can buy, and you will only be allowed to buy that, right? If they say you can have 1 packet of chocolate biscuits per week, that means then you will only be able to buy 1 packet of chocolate biscuits a week. If it's a salad only diet they want you on, that's what you're going to have to buy. So you can see now how the new NHS, the online NHS, this is what they've been building behind your backs. So this is what the distraction has been about. The vaccine distraction, which is creating new customers for the pharmaceutical industry. We know that. The theft of all the money that's been going to various organisations and what have you. This is now all making perfect sense. Why the health passport system's coming in, why they don't need to make it law, because we've got our health passport case just sitting there still, waiting for it to become law. They don't need to make it law because, guess what? It's coming through the new NHSX. So a healthy person can stay healthy and active using our wearables and our diet tracking apps, and can coordinate with a health professional about targeted preventative care on a regular basis. That's what they're talking about. Let me read it again, because I want this to go over. This has to kind of sink in, So we will know we have achieved our goals when a healthy person can stay healthy and active using our wearables and our diet tracking apps, and can coordinate with GP or other health professional about targeted preventative care. Right? That's where they're going with this. And your GP is going to be somebody who is online. It's not going to be your general practitioner that you get, A person with long-term condition can find a variety of supportive apps and technologies to meet their needs, created by the market and working seamlessly with their NHS data. A developer or researcher can easily see everything they need to work with the NHS data and build something to sell to the NHS, which means they can look at your data, they can look at all of our data, and they say, oh, it would be good if this could happen, and they can test it with our data. You can't do that at the moment because it's private. We're all private. So the world-leading research we've always aimed for from our massive body of health data is not only possible, but is producing groundbreaking new clinical treatments. The UK is the global centre of health tech and is exporting our expertise abroad. So this is when they know they've won. So COVID-19 has enabled them to build all of this infrastructure, and they'll know that they've won when a healthy person is basically being told what to eat and what to do during the health app. That's a case study. So this is the idea of, again, no privacy. A clinician, academic, citizen, charity or commissioner can easily find a huge selection of developers and researchers to help with a wealth of experience earned through successful delivery of early working tools. A developer, company or researcher who has hit a barrier in the past around access to data can get rapid responsive help to keep their project moving. Access to data. That's access to your NHS records, to your data, to how you are, to your privacy. This is out of the window. A developer or researcher can rapidly collect evidence on the real world impact for their tool. Great. No privacy. And this is one of their case studies, is the what they call the capacity tracker. This is what they want. We deliver the AI and Data Grand Challenge. So their mission, essentially, is to, when they've succeeded in all of this, and this is already 3/4 of the way in, don't forget, is to have the AI and transformative prevention and early diagnosis and treatment of diseases run through the AI. So their mission to use data, AI, and innovation to transform the prevention and early diagnosis and treatment of diseases. That's how artificial intelligence is going to be used. It isn't going to be used to set nuclear weapons off and destroy, the whole world, as in like Terminator 2. It's used to tell you, when you talk to it, how to treat you, and you'll be treated at home. You won't need to go to a hospital. There won't be any GP surgeries or anything like that. So this kind of all makes sense now, and it all makes sense as why they're trying to get rid of majority of the NHS staff as well, doctors, nurses. They don't need them anymore. They need a quarter. All of this runs on a quarter of the current workforce, and it may even be less than that when it's all up and running in the future. This is all by 2025. This is all coming in now. This isn't fairy tales, this isn't fantasy land, this is new information. We're putting it together, we're building the picture up, and this is something that the world needs to know. This isn't just happening here in the UK. The UK this is the test bed, because we have the world's biggest healthcare system, essentially, believe it or not. And other countries like America, they have different healthcare systems within their healthcare system, if you know what I mean. So, have different companies doing different things. It's private healthcare. All of this is private healthcare. So they want you to basically do everything online. You will pay for appointments, yeah? So if you can't afford an appointment, you won't get one. You have to pay for your appointments. That's coming in. You won't get to see a doctor. You will be seeing someone online. It will be talking to an AI at first, who's going to do all your symptoms and what you're suffering from. Then maybe they will probably treat you. The AI will say, this is what we recommend, and you'll get a prescription through the post. If you need drugs, Amazon will deliver it to you within 24 hours. That's their deal. That's why Amazon have now moved into healthcare. That's why Jeff Bezos is left Amazon, is into healthcare now. He's set up a healthcare company along with Warren Buffett and a couple of other billionaires. They're delivering the healthcare. Amazon wanted to be the shop for everything. Here it is. Now it's the shop for drugs. So they will pick up your drugs and you'll get it within 24 hours, I guess, or even the same day, depending on where you live. Which brings us nicely, actually, to the trial that they're conducting with Amazon and the Amazon Echo. So what they've done is healthcare people, and where's this based? Trialing the use of Amazon Echo in adult social care. I can't see where it actually is because I have made some quick notes going through all this, but I'm sure other people will digest this and all this kind of stuff as well. So what they're doing is they have their social care people, people who look after elderly people and work in those. So whatever skills you have now, they're gone, right? This is kind of just for people. Basically, they want robots to do this kind of, people to act like robots. So the Amazon Echo will tell you what to do. Yeah, so you won't have a manager anymore telling you what to do. Can you go and clean this? Can you go and do that? The Amazon Echo is telling them what to do. We work unceasingly to curate the health tech and emerging care tech. It's called care tech, and it's part of this medical tyranny ecosystem. So that innovators feel supportive and blah, blah, blah. Trialing the use of Amazon Echo in adult social care. And this is working through NICE as well, the National Institute for Health and Care Excellence. So essentially, Amazon Echo is going to be telling people that, Mr. Brown needs his medication at 12 o'clock, so can you do that now, please? Or whatever it might be. So you're taking instructions from the Amazon Echo, which of course is collecting all that data as well and building up profiles. So that's how you see, that's how these devices are working. They're not only listening to you, they have to listen to you so that you can say yes or no to various instructions, and they have to basically tell you what to do as well. So what's going to be happening in the next sort of couple of months? we're going to see, aren't we? We've got the NHS staff who are all throwing their uniforms at 10 Downing Street yesterday. I went to the march in Truro in Cornwall, because now I live in Cornwall. I should be sailing my boat somewhere around the world, but I'm not. I'm here, like everybody, stuck dealing with all this mess. So hopefully, over the next couple of months, we'll see how this all pans out. But this is what the health passport was all about. It's to bring in the online NHS, which we now have. We have proof of this. You see, these people in the alternative media, people like Julia Hartley-Brewer and people like that, even people like Richard Tice, who I really like, and think is great, need to start bringing this up to politicians. This is what, they get to speak to politicians every day. I don't. They do. They interview these people. They need to start bringing in these ideas and start questioning these politicians, because I'm sure most MPs probably don't know that this is happening unless they work in health. They aren't going to have any idea that this is the new normal. That's why normal's never coming back, because they're bringing in an online digital NHS. So this is exclusive as far as I'm concerned, and I hope you feel the same way as well. What Bill Gates has said, and I'm going to repeat it. It's not the full quote. I have the full quote, which I have put on Twitter, and I have put it on Facebook as well. So if you follow me, you go onto Facebook and Twitter and all that kind of stuff, you can find it. He said, "I'm doing today what J.D. Rockefeller did for medicine. By 2025, doctors will be no more important in society than car mechanics." I hope I've made sense of what's going on. It is complicated, I know. It isn't easy to get your head around all this stuff. I found it difficult, and I'm sort of kind of in deep with it. I've been following this for years and years and years. I've been doing this since the early 90s. 1994 was essentially when I woke up to the idea that politics was completely corrupt, because we did Cash for Questions with Cook Report when I worked for them. And then seeing how, I was bullied and taken to court over my accusation against Ken Clark, which is outrageous. I won that court case, and I won it by telling the truth and having the truth speak for itself. So let's hope that the truth comes through, that you understand what I've been saying. It is complicated. There is no script to this. There is no auto cue. There is no team of people behind what I do. It is just me and doing research, endless research, talking to people. If you want to do research, it isn't watching endless YouTube videos. It is picking up the phone and talking to people, and they will talk to you. At some point, you will find somebody somewhere who will talk to you. Be pleasant, be polite, be courteous, understand their point of view, and you'll get a whole lot more, I promise you that, right now. I mean, I've got people in the police force who I talk to on a semi-regular basis. I've got people all over the world, really. State Department in America talk to me a lot. I've got people there. I've got various, former intelligence officers and what have you, who will send me things or talk to me. So this is, people in the House of Lords will talk to me. So we're opening the doors and we're allowing these people in, because we want to learn what they know, right? There's one thing about, criticising what's going on and pointing things out, which is, we need to do that. That's all very useful stuff. But also we need to understand where these people are coming from. It's like, okay, a lot of people now are realising about the depopulation idea. That's a real thing. We know it's a real thing. We've been talking about it for years and years and years, being a real thing. Most of the public didn't believe it until now. And the way they're doing it is through these vaccinations. We know there's a fertility crisis. The Times criticised me some months ago now about, where did this infertility idea come from? Well, it came from GlaxoSmithKline-owned servers, their website, which, of course, that video was pulled immediately because it was truthful. It was telling the truth. So we know, that's why we couldn't get access to the vaccines to test them, even though I had a lab. I got a team of scientists who were one of the top tier teams of scientists in the world for testing vaccines. By the way, they weren't just it's not any lab anywhere, and we would have had to have sued the government to get access to the vaccines right at the beginning of all of this. We'd have had to have sued each vaccine manufacturer to get access to the vaccines. And then we'd have had to have a team of sort of lawyers going into these factories, getting random samples to test. It was just not going to happen. You know, we've had the health passports campaign running now for nearly, well over a year and a half, nearly 2 years, I think. It was right at the beginning, wasn't it? And we still haven't raised enough money to sue the government. We've got enough money to start that process, but unless people are putting in, we still haven't raised that amount of money to sue them over the health passport scheme, which looks like it's not going to be brought in by law anyway. It's going to be brought in through this. And this is the online scheme, so it's all going to be for your benefit. Tyranny comes in helping you. This is what all tyrants say. And there are better ways of dealing with all of this. There are better conversations to be had. It is almost like the idea of, you know, people who are vegans who are saying, you know, stop eating meat. If everybody stopped eating meat, all the farm animals will just be killed. That was it. You won't see a cow, you won't see a sheep. Who can afford them, right? There are, however, conversations to be had about how we deal with animals, how we deal with climate change. You know, carbon dioxide, by the way, if you get rid of carbon dioxide, we die. Think about it. Carbon dioxide is what we breathe. We breathe out carbon dioxide, breathe in oxygen, out carbon dioxide. If carbon dioxide levels go down significantly more than they already have, yeah, grasses die. If grasses die, we're dead long before grasses die, by the way, and stuff like that. So again, there's arguments to be had and conversations, sensible conversations to be had, but we're not given a choice now. The tyranny has come in. This is basically it. You won't be able to travel unless you've got the permit to travel, essentially. And now we're looking at a fertility crisis unprecedented in modern human history, because of what is coming down the line. Even the BBC now are running the fertility crisis articles and stuff. They're getting you ready for this idea. And no more babies means no more human beings. Once it drops off the cliff, and it will drop off a cliff, you know, we're in serious trouble. You know, people are in serious trouble. You know, they've been trying to tell you that there's too many people, that we're overpopulated. It's simply not true. With the vaccines, not everyone is going to be infertile. It is going to be a Russian roulette, yeah, which is why they're desperate to give it to kids, because they wanted to make kids infertile and healthy, you know. So anyway, I hope this has explained and pulled together a lot of information for you. It is dense. I get it. It is complicated. The basis of it is basically, this makes sense of the health passport. So you're now going to have your NHS number, which everyone has, by the way. Everyone has an NHS number, is your personal identifier for everything that you want to do. That's important to know. This makes sense of the health passport scheme. This is the detail of the health passport scheme. It is bringing in online medicine, and that's why they're trying to get rid of most of the NHS. I'm sure they'll do a little U-turn and say that the staff don't need to be vaccinated, only to make their lives a living misery, so they end up leaving voluntarily, because that's what they want. We know, because of corporations, that if you can get people to leave voluntarily, you know, if your life can be made a misery, you'll leave. And that's what they're probably going to do. And I feel really sorry for all those people that are working for the NHS right now who don't have the vaccine, who don't want to take the vaccine. And surely, you know, this is a message to everybody out there. If the health professionals, if doctors and nurses don't take this vaccine because they don't trust it, and they don't want to, you know, put something in their body that they don't know about, that should tell you something as well, just to let you know. I want people to be able to have freedom of choice, body autonomy. I decide what goes into my body, but not the state. I own my body, not the state. It's as simple as that. So I think we're going to be doing more of these videos. There's certainly a lot more information coming out. I would like to get some guests actually turning up, which I think is great. So, you know, if people know people that should come on, we'll set up like a podcast and we'll do it all properly. and we'll get things a bit more organised than they have been. Just to give you some mega search news before we go, we're a couple of weeks away from mega search going live. That's the search engine. We have broken into the internet. We've created a search engine that looks so spectacular and amazing. It is unlike any other search engine. It is private. It will not censor anything. You can, and it looks fantastic as well. It looks amazing. We've really simplified the process, and we have innovated. They're talking about innovation. We can do that too. We have innovated. So we have got the biggest independent search index in the world. We have access to. Which means that you'll go on there and you type something in, you're looking for something, you'll find it, right? And that's only going to get better as we grow as well. You can register your website with us for absolutely no charge whatsoever. It's a free listing. Then there's advertising you can pay for if you want to go down that road. It's entirely up to you. And we think that this is going to be the future of the internet, which is privacy. Things like DuckDuckGo, you're not private. You're private on their page. As soon as you're off their search listings, comes from Google. So as soon as you're off there onto their search listing, you're on Google, and Google are tracking you, following you, and doing all that weird stuff, that creepy stuff that Google do. So even DuckDuckGo, even though they're claiming to be the most private, this, that, and the other, they're actually not, because they work with Google, and they pay for Google's search index, and along with many other of these meta search companies. They either use Bing or they use Google. Our internet, our search engine, has its own index. It's the biggest index outside of Google. And it's pretty much almost as big as Google, actually, because it's been indexing since 1997, and we have access to it. And that is absolutely amazing, which is great. So we're up and running in a couple of weeks. We still need your support. This costs a fortune, by the way, to run. The crowdfunding that we got long went, and now we're funding it ourselves. We need servers and stuff like that. So if people want to donate, people want to help out, they can. I probably will run another crowdfunding campaign as well. So just to give you some updates, that's great. So also, our servers are going to be in a country where none of the big countries can get to. It is protected by legislation. So that's another layer of privacy that people don't often think about, where the servers are and stuff like that. So that's some news. I hope it has made sense to you. And everyone now can delve into this. This is a scandal of the highest order. This is what Bill Gates is talking about. This is what Bill Gates has been talking to Boris Johnson about and all the other world leaders. We are the experiment for the new healthcare, private, by the way, healthcare system. All of this isn't free. You're paying for it. And that's the other thing that is part of all this. You pay for the service that you want. If you want access to your records, you pay for it. If you want access to an appointment, you pay for it. If you want access to to speak to somebody, a person, you pay for it. It's all about paying for it, and so I guess the more money you have, the more access to money you have, the better healthcare that you'll get, as always, right? I've got teeth falling out, and I've only just managed to get a dentist. It's taken me years, literally years, to get a dentist. So now I've got one, and it's costing a lot of money, to put things right. And of course, people aren't going to be able to afford to go to the doctor. People are going to be dying in their homes and stuff. I don't want to scaremonger. I don't want to do anything like that. This is just information. But I think it's worthwhile talking about it. And I think that's what we are doing. And that's what we're going to continue to do. So thanks for watching. This needs to now be brought up with Parliament. This needs to get out as far and wide as you possibly can. If you want to repeat this information, you can. It would be nice if you put up a link back to me. That would be great. This is the first time anyone's ever heard this information. It is coming in. And I thank the person, the former director of the Bill and Melinda Gates Foundation. You know who you are. I thank you for your information, and because you've really tied things together for us. So until next time, hopefully we'll be a bit more organised in the future. And thanks for watching.